Hi, my name is Carl Hansen, and I am a physical therapist with St. Alphonsus Medical Center in Baker City, Oregon. And I'm actually here to talk to you today about shoulder injuries. In fact, shoulder injuries are a huge part of a huge problem for our society today. In fact, the American Academy of Orthopedic Manual Physical Therapists state that in 2006, approximately 7.5 million people went to the doctors for shoulder injuries. And 4.1 million of those shoulder injuries were actually due to rotator cuff injuries. A lot of times people really discount shoulder pain and just say it's going to go away. And there's a lot of things that you can actually do to help prevent shoulder injuries. But the first couple questions you should ask yourself is one, does my shoulder feel stiff? Does it feel like I don't have the movement that I usually have in it? Two, do I have any popping, or does it feel like it's going to go out of joint on me ever? Or in three, do I feel like I don't have the strength that I used to have to do certain activities with my shoulder? If you have any of these yes to any of these three questions, then you should actually follow up with the doctor to see if you possibly have something going on with your shoulder. Oftentimes, shoulder injuries are caused by excessive repetitive overhead motion, such as reaching overhead with daily activities such as work or with fixing blinds, cleaning, and it can even be associated with athletic things such as swimming when you're doing the overhead motions, or with overhead throwing such as a baseball and stuff like that. And so we see that the shoulder is one of the most mobile joints in the body, and because of the shape of it, it has so much motion but yet lacks stability a lot of the times. And the shoulder really plays a huge important role in our daily life. Now the shoulder has really a couple components that really play into it. You have the glenohumeral joint, which is the most important joint. However, you have the scapulohumeral joint, which is the shoulder blade, and how the shoulder blade moves will affect our motion of our shoulder, as well as the acromioclavicular joint and the sternoclavicular joint all play a role in allowing us to get full motion of the shoulder. Okay? A lot of times, shoulder motion, just by affecting our posture, can lead to improvement in motion. If we look at people that have rounded shoulders and their shoulders are rounded here, they have decreased motion until they can get their shoulders back into a better position, and then they have full range of motion throughout the shoulder. Now, the rotator cuff is made up of four main muscles, what we call the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. But along with those, you have other muscles that make up the scapular stabilizers, which we look at what we call the rhomboids, the middle, upper, and lower trapezius, as well as the teres major, stratus anterior. There's a lot of muscles that really play a huge role with all of the shoulder, and so there's a lot of exercise you can really do. However, I'm going to focus on four main exercises that I feel are the most important to really strengthen the shoulder up and get the most benefit for your buck. So the first one we're going to begin with is what I call external rotation. And external rotation plays a huge role because it strengthens up part of the rotator cuff. Okay? So what we look at beginning with is keeping our elbows at our side, hands in front of us, okay? And you can do this exercise either with one arm or you can do it with both arms at the same time. You can actually adjust it so that you're doing it at a 90-degree angle. But what you look at doing is keeping the arm to the side here for this one right now, okay? Not behind us, way behind us, but slightly forward. And what we're going to do is keeping our shoulder blades back, we're going to pull the band out, keeping our elbows at the side. The next exercise that I really like is what I call a shoulder diagonal. And in therapy terms, we call it actually a PNF pattern. But for this purpose, we'll call it a shoulder diagonal. Now, a lot of times, we don't really function in the straight plane right here or on the straight side. A lot of times, we're doing things out to the side. Okay? Hardly ever do we do things straight here. We sometimes do it across. But this exercise to begin with, so if we were to look at the shoulder again, and say this is 0, this is 90, we're going to do it at a slight 45. Okay? 0, 90, slight 45. What we look at doing is taking the TheraBand, okay, stepping on it, and again, you can do this with weights if you want to instead, but what we're going to do, okay, is we're going to take the hands, going thumbs up, pulling our shoulder blades back, hold them back, not elevated like this, put our shoulder blades back, come straight up, back down, again at that 45. okay? Not from the side here, and not straight forward, but at a slight 45. And to progress on that, another exercise I like for strengthening the supraspinatus, which is the most common injured muscle, I'll call it the empty can exercise. So what we're going to do now is instead rotate our thumbs down, okay? Now with this exercise, it's important that we don't go up as high as we can go, but instead go to about shoulder height, okay? And slightly less than that. And what we're going to do is go at that 45 again with our thumbs down, okay? Shoulder blades back, up to here. Okay, the next one is really important to start getting those scapular stabilizers to kick in, is what we call horizontal abduction. And what you do is taking the ThunderBand out in front of you, okay, shoulder blades again, pulling them back. What we're going to do is pull the ThunderBand straight across to your chest, about where your nipple line is at, okay? So from this position to right to here. Okay. The last one, to start pulling in some more scapular stabilizers, I really like, is that we can do the push-up. The push-up is one of the great exercises for strengthening the shoulder. However, what we're going to start off with is with the wall push-up. And from this position, we go into here, okay, dropping ourselves down to the shoulder into the wall, coming out, and rounding our shoulders around, pulling our shoulder blades back, going back into the push-up. That starts to strengthen more of the rotator cuff, the stratus anterior, other muscles, okay? Now it's important now with any of these exercises, if you do have pain, that you make sure that you stop these exercises immediately, do not continue with them, and then follow up with either a healthcare provider such as a doctor or a physical therapist to discuss this. Because either A, you might be having some other stuff going on, such as an impingement, such as a small tear, and you need to talk to your doctor about it before you continue with the exercises. There's a lot of other exercises that you can really do to help strengthen the shoulder, but again, these are some just basic exercises you can do to help strengthen. I thank you for your time, and if you do have any questions, I recommend that you just follow up with your therapist or doctor and just discuss any shoulder issues that you may be having.